The big difference really between infirmaries and dispensaries tended to be that infirmaries treated primarily acute conditions. So whether it was somebody needing an operation or somebody with a very kind of advanced case of tuberculosis, for example, it tended to be people in a very acute state. Dispensaries, although they still had some patients like that, tended to be much more chronic. So these are the long-term medical conditions, maybe that they wouldn't have been admitted to an infirmary for, maybe they would have just lived with for an incredibly long time. So it was rheumatism. It was sometimes very advanced states of venereal disease, but often things like mental health related conditions, headaches, an awful lot of people with intestinal worms. It's essentially a huge raft of often debilitating, but the sort of conditions where you would probably still keep working, still keep living with your family, and you would somehow just keep going. And one of the things that stands out is how many different medical conditions one person would have. So someone would go to the dispensary when something got sufficiently bad, so their eyesight got so bad they literally couldn't see. And then Duncan would say, well, they've come in for this, but while they're here, they've also got 2 broken fingers and they've got intestinal worms, and this woman hasn't menstruated for 5 years. You know, so they'd have all these things that they would just survive with. And I think that's what I found really interesting. A lot of the time when people look at the history of medicine, they really focus on the dramatic diseases, the syphilis, the smallpox, you know, these sort of small number of often very quickly fatal, really dramatic diseases. So it's what people die of, but there's also what people live with, you know, that people just kind of come to terms with. And one thing that surprised me was over 50% of the women who were admitted into the dispensary were not menstruating and hadn't menstruated for at least months, if not years, which says an awful lot about, you know, the nutrition and the lives that they were living. So I think this gives a lot more insight maybe into the social side or the human side of people's lives, rather than just when people are on their deathbeds. This is everyday people's lives.
So that tells quite a lot about the attitudes of people towards seeking medical assistance. So was that due to a lack of knowledge, or due to the fact that it was just something that you lived with, or an aversion to some of the treatments that doctors were giving?
It's a combination. I think partially it was quite difficult for a poor person to gain access to a doctor. You really had to be admitted to an infirmary or a dispensary, because generally speaking, the amount that a doctor would charge in his private practice would be just beyond people's means. I guess as well, there isn't such a fine line between what is professional and unprofessional medicine, because of course we know now, you know, you are a qualified doctor or you're not. Obviously it wasn't that simple then, so people would think just as much perhaps of a local healer or, you know, a local sort of itinerant seller of, you know, medicines as they would of Andrew Duncan or someone similar. It was much more grey area. And one of the things Andrew Duncan recorded about his patients was if they had tried to undertake any other treatment, you know, non-professional or non-physicianly treatments, he recorded those. So there are quite a few examples of his neighbour told him to rub butter on his head for this wound. And then Andrew Duncan, you know, slightly sort of scathingly says, maybe if you have an open wound, rubbing butter into it isn't the greatest idea. So there are still hangovers of these kind of folk medicine, or really very much on the cusp of what we would actually think of as medicine, because it is almost this sort of mystical end of medical practice. So they were sometimes trying these things, but largely it was restricted access through lack of wealth. I mean, these weren't just working class people, these were often the poorest of the poor. So they just didn't have that many resources open to them.